This presentation is brought to you by Amanda Parks, Dorothea Haynes, Roderick Preacher, Haley Fawn, and Sarah Bystrad. Nursing care of the Japanese patient. It is important for healthcare workers to be mindful of cultural practices, spirituality, and care practices of the various cultures they care for. Using the transcultural nursing model, we will explore the Japanese culture, learning how they view the world, their cultural attributes, and the nursing implications throughout the lifespan. As holistic nurses, we recognize each person as a whole body, mind, emotion, spirit being, and mutually create a plan of care consistent with cultural background, health beliefs and practices, sexual orientation, values, and preferences. Here are some of the cultural attributes for the Japanese culture. It is important for the nurse to take these attributes into account when caring for patients from this culture. Breaching these can cause some difficulty in rendering care. Childbearing is an important event in all cultures. The Japanese mother may experience discomfort, but may not ask for anything for pain, for fear of appearing weak. Education throughout the pregnancy is important. The mother should be told that having pain medication is a normal part of the process. Nurses can also look for nonverbal signs and symptoms of pain and offer medication. Again, bearing in mind that it may not be accepted. The Japanese culture throughout the lifespan. We begin with the pediatric aspect. In many cultures, children are given autonomy. In the Japanese culture, children are seen as an extension of the mother. Japanese infants are constantly within their mother's reach. Co-sleeping and co-bathing from birth are normative practices within this culture. It is important for nurses to be respectful of this relationship. Mothers are seen as the primary caregivers in the Japanese culture, while husbands are responsible for making money for the household. Adults 18 to 64. During adulthood, it is more apparent how health and illness affect how an individual responds to health promotion and wellness by shaping lifestyles. There is a stigma related to mental health, which can be a stumbling block in seeking appropriate care. Adults see mental health as being a health problem that brings shame to their family or community. This group will need a lot of reassurance. This group also has core cultural values such as honor, pride, patriarchal obligation. Understanding the cultural core values and the importance of maintaining harmony will help nurses plan care for patients with mental health problems. We now peer into the older adult. Because the patients of the older Japanese culture speak in their native tongue, it is important to have an interpreter or an interpreter phone available for good communication. Being able to communicate with the patient is important for rendering proper care. It may not be very easy to get an older Japanese person to discuss much about care because illness is not discussed openly among this group. It is vital to make the patient feel comfortable enough to discuss symptoms and/or concerns. Expect that there will be many family members, especially the spouse, close to the bed. In the Japanese culture, the sick are usually cared for by women. It might be beneficial to ensure that enough female staff are available. Communities. The urban Japanese community incorporates a variety of age groups and family systems. While healthcare and education is more readily available to this population, income for the younger working class is a barrier to seeking out healthcare. Rural Japanese communities serve a more traditional family structure, with more of an elderly population. Access to healthcare and education are limited due to a steady depopulation of this community. Extra emphasis on health education is vital when treating patients from this community. In summary, it is important to be educated on as many aspects as possible of specific cultures to provide culturally competent care. Each age group and community has specific cultural differences, but overall, the Japanese culture values courtesy, respect, and harmony, with an increased focus on family. By incorporating these cultural beliefs into their nursing practice, nurses can provide competent care to the patients of the Japanese culture and in turn provide a better patient experience. We hope that you have enjoyed our presentation of the Japanese culture. The next few slides are the references that we use to provide this presentation. We welcome your questions, comments, and critiques of our presentation. Thank you very much.